Vaping, safety concerns, and emergency treatment. Have you ever heard of the consequences of vaping? Although not all of the consequences for the long-term use of e-cigarettes and related products have been determined, lung disease and associated respiratory distress is one consequence that has been established for the long-term use of vaping. More than 193 possible cases of severe lung disease and related illness associated with the use of e-cigarettes and other products was reported by 22 states between June 2019 to August 2019, proving how big of an issue vaping really is. Lung infection and disease due to vaping is caused by substances getting into air sacs inside the lungs instead of air. Fluid and immune cells, like macrophages, build up inside the air sacs, which can then lead to lung inflammation and difficulty breathing. Macrophages also try to clean up the fat from the substances that are inside the air sacs that build up in the lung, but rather accumulate and also cause lung inflammation. Signs and symptoms of abuse to look for in users include, but are not limited to, respiratory symptoms such as cough, shortness of breath, or chest pain, gastrointestinal symptoms like nausea, vomiting, or diarrhea, and other symptoms like fatigue, fever, weight loss, and a rapid heartbeat. Sick is a slang term used by teens to describe a group of non-specific symptoms of exposure to nicotine, especially when the person is having more than what they're normally supposed to. Sick happens when someone is experiencing nicotine overdose. The next couple of slides will let you know what symptoms to watch out for. If you are worried about a potential nicotine overdose, here are some symptoms that occur within the first 15 minutes to an hour of being exposed. Gastrointestinal symptoms like nausea, vomiting, stomachache or loss of appetite, mouth watering, quick, heavy breathing, headache, dizziness, confusion, or anxiety. Within 30 minutes to hours, the symptoms shift to more severe, such as weakness, slow reflexes, extreme fatigue, slower heartbeat and lower blood pressure, shallow breathing, pale skin, diarrhea. If you or someone around you suspects an overdose or in the event of an emergency, call 911 as soon as possible. Once someone has called 911, these are possible treatments that a healthcare professional can take to help save someone experiencing nicotine overdose or in emergency situations related to vaping. Supplemental oxygen, assisted ventilation, oxygenation, use of corticosteroids, or intubation. Overall, the use of e-cigarettes might not be as safe as they were thought of originally. There still needs to be more research done to determine the consequences of the use of e-cigarettes and vaping. The research thus far has concluded that there are many harmful consequences that come about from using e-cigarettes and related products. If you are interested in learning more about vaping and how to help your students, you can check out these resources that we have provided. Thank you for listening.